Hello viewers, welcome back to another video. Myself Dr. Prashant Biradar, orthopedic surgeon. Today in this video we will see a most common condition, especially in elderly patients after 50 or 60 years of age. Because of the osteoporosis, that is thinning of the bone, there are very high chances of fracture in trivial trauma also, domestic fall also. Okay, so when the patient had a trivial fall on the outstretched hand and the body weight falls on your wrist, there are chances of fracture in the wrist bone. We call it as a radius, and in some patients there is a fracture of ulna also. So here you can see the radius in ulna fracture patient X-ray. So this is the radius fracture. So here you can see this is a radius and this is a ulna. So here this is a AP view. AP means anterior posterior view. So in this you put up your palm and wrist flat on the X-ray tube. So here both bone can be seen separately. So here is the fracture in radius. So when we see on the lateral X-ray, this is a lateral one. So lateral X-ray, you can see the angulation, how the fracture got angulated. So in this case, what we have to do is to reduce the fracture, get the fracture back to its position. If it is stable, we can put a cast. If it is not stable, again if it is going back to the this position, then you have to stabilize with the wires. So basically these fractures are common in elderly persons, but these fractures can occur in young patients also, but it should be a high energy trauma like fall from height or road traffic accidents. In that case also it can happen in younger patient also, but mostly it is common in elderly patients. So the patient, how it will how the patient present with patient will have a pain, swelling, so patient is not able to move the wrist joint. Initially a lot of patients, what they'll do, because they had a trivial trauma, domestic fall, they'll think nothing is happened, so they'll take some medication, painkillers, and because of that painkiller and that tablets, the swelling get reduced, but the fracture, because of the fracture, the pain won't go and patient won't be able to do his regular activities. So for that they'll come after 4-5 days to us, sir, even if the swelling has subsided, but the pain is there and I am not able to do the work. So basically at the first instance, first place only where they have shown, you should get a X-ray in elderly patients, because there are high chances of fracture. So once you get the X-ray done, you will be able to see it and you can show to the patient also. So this is all about the wrist fracture. So as I told you, this we have to reduce it, and you have to do plaster for these patients. So in this case we tried to reduce it and put a plaster for this patient, but as it was not stable, we had to put a wires in this case to stabilize the fracture. As the patient presented late, so we had to give anesthesia, because if the patient comes immediately after the fall, then that time only we can reduce it under local anesthesia. So it will come easily, but once the patient patient has taken primary treatment somewhere else and coming to orthopedic surgeon after 4 5 days or 8 days, in that time there are there are reduction of the fracture is very difficult under local anesthesia because of the pain and stiffness, and sometimes they get massage done also, so the stiffness increases. So in this case, patient presented late, so to reduce it we had to give a anesthesia, that was a local block anesthesia, and under the block we operated. We reduced first, reduced and stabilized with the K wires. So this way we achieved a normal alignment. You can see here. So in the lateral radius there was a angulation, but after reduction the angulation has gone. The radial height also is maintained. If you see, the radial height has come to normal. So one more thing is, after the surgery we have to put a plaster for at least 4 weeks, and the wires will be there for 4 to 6 weeks. So during that period patient won't be having that much pain, so he has to do a finger movements so that stiffness won't occur and swelling will get reduced. So once the plaster is out, wires are out, patient has to go under physical exercises or strength exercises. Okay, so within 8 to 10 days patient will have full range of movements. So what are the complications of this type of fractures? If the patient is not taken proper treatment, then the fracture will unite in the wrong position, that we call as a malunion. Second, sometimes patient go to quacks and they get massaged, so because of that the stiffness increases and there are chances of continuous pain for long time, sometimes lifelong also. So these are complications if patient is not taking proper treatment. And so I advise, if you are having a injury to the wrist, please consult a proper doctor. If orthopedician is available, well and good, you show to orthopedician and get it treated as early as possible. Okay, because if you delay it, the complications are going to increase. So thank you very much for your attention. Kindly please subscribe to the channel, and if you have any queries, please mention in the comments. If you want to listen to other topics or of your interest, you can mention in the comments. Thank you.